Hi everyone, Dr. Patel here with the Hillside Medical Group. So this is going to be probably the by far most important message I will be broadcasting to you guys, and I'm speaking to all of my patients that are probably 64 years and above for most part of it, specifically referring to Medicare patients. So if you are a patient that is about to enroll in Medicare or are already part of Medicare, please make sure you watch this video till the completion of it, okay? All right, so what are we talking about? October 15th. All right, I think most of you guys know what October 15th means. October 15th is an extremely valuable date for you guys. Reason is because October 15th is when you will be able to go to the market and shop for your health insurance. Yes, you have to shop for your health insurance now. It's not like back in the day where you have Medicare, you're golden, everything is covered, great. No, you know this. Over the last few years, you have been getting crazy amount of marketing. Well, once this October season starts, between October 15th till end of the year, and it's super important for you to recognize the importance of this open enrollment period between that October 15th on till end of the year and shop for your health insurance. Again, do not ignore this. I know it's frustrating. I have a mother that is part of Medicare, and it's extremely frustrating amount of marketing emails we get, amount of phone calls we get, amount of marketing that happens through television, mailers, etc. But it is super important to pay attention to this period and do a few things that I'm going to go through over this video and shop for your insurance. Please do not ignore this time. All right, so what are we going to do during this open enrollment, October 15th? If you have a trusted agent that has helped you with signing up for your Medicare insurance in the past, reach out to them if they do not reach out to you. Very important. The part to what I had just said is trusted agent. A lot of agents are going to try to approach you to try to sign you up because their commissions are built on this. So it's super important that you find your trusted agent. And if you don't have that trusted agent, I will be putting in 3 independent companies that we vetted, and we trust them to do the right thing by our patients. So you will have that recommendation from us. And now, full disclosure, I don't get anything out of it. Okay, so they're trusted, as in we vetted them to make sure that they are doing what they're supposed to be doing, enrolling people into the plans that are best for the patients, not necessarily best for the hospital systems or for themselves or for us. To me, it makes no difference what insurance plan you pick because our contracts are same across. But the trusted agent is supposed to do these few things for you guys. One, they're supposed to make sure all your doctors are in network with that new insurance that they will enroll you comes January. Very important. Very important, okay? January comes, we notice this all the time. Patients picked a new insurance plans. Later they realize, oh my God, I lost my cardiologist. Now please send me a referral to a new cardiologist. Well, guess what? These guys are booked out months in advance. Chances are we're not going to be able to find you a new cardiologist. Even if we do, chances are they're not going to know you as well as your current cardiologist already does. So it's super, super important. One, make a list of all the doctors that you see. Make sure that the agent looks at the in-network status and verifies that yes, your doctors are in network. And that does not just mean my office and myself. It means every single of your consultant. If they're not, reconsider your insurance, because it's easy to change insurance, much more challenging to change your doctors. Next step, bring out all your medications. Yes, take all the bottles to that agent. Tell the agent that I want you to tell me exactly, comes January 1st, based on this new insurance, what is it for me to expect when I go to pharmacy that it's going to cost me when I am on these medications. Some of you guys have noticed that January comes, new insurance plan says, oh, you've been on this decade-long medication. No, we've decided that we're going to save some money by picking this new insurance or new medication, so let's change it over to that. Why? Why should we have to change the medication that's been working for a decade on our patient when in reality they're just trying to save a buck, few dollars on it? No, verify with that insurance agent that your medications that you've been on it forever is getting covered. Find out if you're on HMO or PPO plan. Why does that matter? Because if you're on HMO plan, guess what? You're on limitations. What does that mean? Comes January 1st, you and I were sitting in my exam room. Theoretically, say you're coming to get checked out for a headache. Now, you and I, we decide in my exam room after your evaluation that you need an MRI. Well, guess what? You're in an HMO plan. Someone's going to need to look at your chart, get it approved. Every time you need a referral, you need to make sure you come to a primary care doctor. We document the exact reason why you need to go to that consultant, why you need that imaging done, why you need the lab test done. Even after that, there is another doctor or someone on the other side on the insurance world that will decide if that's the right thing to do or not. Excuse me, hold on. Let's think about it. Because you're on an HMO plan now, even though your doctor examined you, decided that yes, you and I, both of us decided that you need to get this test done, there will be a third person that has no knowledge of you, who's never going to see you on a televisit, leave alone in an office, but they will decide based on the charting if you need this test or not. Sounds like someone is trying to save money over there. Be careful. It's okay. If you decide that best for you is going to be to sign up for an HMO plan, that's okay. It may be the right thing to do, but then have the right expectations. Know that HMO plan is going to require approvals. Approvals only happen after there are documentations in chart, which means you're going to need to come to your primary care office, our office, to get appropriate charting to justify why we're ordering what we're ordering. And even after that, it doesn't mean it's an automatic approval. It means that someone on the other end, on the insurance world, is going to review the chart and then decide if you actually would need that treatment or not. 3 things, let's recap again. Are your doctors in network? Are your medications covered? And even if they are covered, that's not good enough answer. Exactly how much is it going to cost us to pick up those medications from pharmacy? Comes January 1st. And the third thing is it a HMO or a PPO? And if it's a HMO, have the right expectations. Things are going to be delayed. Referrals take anywhere between 2 to 4 weeks to get approval. It may also be denied. Know the right expectation that imaging may take 2 to 4 weeks to get approvals, but it may get denied. And then if you're comfortable with all that they're telling you, then pick that plan. And make sure my office, Dr. Darren Patel and Hillside Primary Care is picked as their primary care. Otherwise, comes January 1st, when you come to our office and the card does not have Hillside Primary Care or Dr. Darren Patel on it, chances are that we're going to have to ask you to call the insurance, change the primary care. If you're on an HMO plan, change the primary care over to our office before we can provide services, because your insurance will deny that claim and that balance will come back to you. These are very, very important things to plan. Please do not ignore. And if you need help with this, again, we have vetted 3 independent agencies, so please fill out this consent to reach you, and they will reach out to you to help you with your enrollment. One more thing I want to add on to this message, and that's I want to thank you. I want to thank you for allowing my office, my organization to participate in your care. 7 years ago, when my wife and I, we started this organization, we only had one goal in mind, and that was to provide access to care. When we started the office, one of the biggest challenges our community dealt with was patients were not able to get into primary care office for 2 to 3 months. At this point, with Hillside Medical Group, Hillside Primary Care, our patients are able to get into offices within 24 to 48 hours. So I think we're continuing to accomplish that. I want to humbly request that there are many people that don't know about our office, that don't have access to such amazing care. So during this open enrollment, if it's not too much trouble, help us spread more knowledge of Hillside Medical Group. Talk to your friends, family, neighbors, at your churches, at other community events, at Christmas parties, Thanksgiving, I don't know where. But please help spread the word of Hillside Primary Care. And if you know of friends, family that are in need for primary care, please try to refer them to our practice, so that way they can also continue to benefit from the same care that you're receiving at our office. We're not perfect, I know that, but what differentiates my organization, myself, from everyone else is we're continuing to work towards making sure whatever we can do to continue to improve our organization for your benefit, with keeping our patients as the center of our universe and building an entire network around our patients to be able to provide the highest level care. I humbly request to you again to refer your friends, family, anyone that you may run into that is in need of primary care, to Hillside Primary Care. Again, thank you for everything you do for us, and we look forward to treating you and taking care of you for years to come. Enjoy your holidays.